If you have hepatitis A or B, your liver is inflamed because you have been infected with either the hepatitis A virus or the hepatitis B virus. Your liver is a soft, flexible organ that performs many important functions. The functional parts of your liver are called hepatic lobules. Your hepatic lobules filter all of the blood in your body. As the blood passes through, your hepatic lobules break down harmful substances. Remove bacteria and worn-out blood cells, and forms clotting factors that control bleeding. After a meal, your liver stores nutrients to provide your body with energy when needed. Your liver also makes a substance called bile. Your gallbladder stores bile and releases it into your small intestine to help digest fats in the food you eat. If you have hepatitis A, the virus entered your body when you were exposed to fecal matter from a person infected with the virus. You may have been exposed to the virus by eating contaminated food or water, contact with infected feces, such as during a diaper change, or having unprotected sex with a person infected with the virus. If you have hepatitis B, the virus entered your body when you were exposed to the blood or other body fluids from a person infected with the virus. This could have happened from sharing a drug syringe with an infected person. Other ways you may have been exposed to the virus include having sex with someone infected by the virus, sharing personal hygiene items such as razors or toothbrushes used by an infected person, direct contact with the blood or body fluids of an infected person, or when a mother passes it to her baby during birth. When either the hepatitis A or B virus enters your liver, it invades your liver cells and makes copies of itself. In response, your body sends immune cells to attack both the virus and liver cells infected with the virus. As a result, these liver cells become inflamed and then die. Over time, scar tissue forms around dead and infected liver cells, which prevents your liver from working properly. If you have a chronic hepatitis B infection, your liver contains a large amount of scar tissue called cirrhosis, which limits blood flow and results in permanent shrinking and hardening of your liver. If you have hepatitis A, your doctor won't prescribe any medical treatment because your immune cells will eventually find and destroy all of the hepatitis A viruses in your body. If you have hepatitis B, your immune system will usually remove all the hepatitis B viruses from your body. In some people with chronic hepatitis B, particularly children, their immune cells are unable to remove all of the hepatitis B viruses. If you have chronic hepatitis B and your immune system can't get rid of the virus completely, your doctor may prescribe antiviral medication. If you have a severe case of chronic hepatitis B, your doctor may recommend a liver transplant operation.
These 6 warning signs show that your liver is full of toxins. The liver is a vital organ located in the upper quadrant of the abdomen right below the diaphragm. It has a variety of functions, with its main one being the detoxification of the body. If not for the liver, toxins may accumulate in your body and cause numerous health problems. The liver transforms toxins into waste material which are later expelled through poop and urine. It has a difficult and dirty job, which is why it needs to be taken care of. In order to keep your liver and your health in check, you need to perform a detox method once in a while so you can remove the excess toxins in your body. You can perform a detox whenever you want, but make sure to pay attention to the following symptoms of liver toxicity. 1. Sudden weight gain. If damaged or overworked, the liver can't perform its duties properly, which will lead to toxin accumulation in your tissues. Over time, the body will get used to storing toxins in fat cells, eventually making you gain weight. If the liver is focused on something else, it will store toxins in your fat cells, so make sure to live a healthy lifestyle in order to keep it clean and running properly. 2. Allergies. When there's something wrong in the body, the liver releases antibodies which are supposed to fight the problem. However, it won't do so if it's occupied with something else. The brain sends signals to the liver that the body is attacked by allergens and the organ marks them for removal, but can't finish the job if it's focused on another problem. The buildup of histamine in your system will quickly become a problem and cause numerous allergy symptoms such as itching, headaches and dizziness. 3. Chronic fatigue. According to Dr. Edward Group, chronic fatigue is the main symptom of liver toxicity. Toxins can disrupt your system and cause aches, fatigue and different types of pain, which is why the toxicity needs to be addressed sooner rather than later. Dr. David Busher says that the problem might get worse if a backlog of toxins comes back and attacks the whole immune system, leaving your body without its primary defense. 4. Excessive sweating and body odor. The liver is similar to a car engine. If it works non-stop, it will overheat and raise the internal body temperature. In order to reduce the temperature, the body will start sweating more, which can result in body odor. 5. Acne. The overload of toxins in the body can cause hormonal imbalance, which may cause acne to appear on your face. 6. Bad breath. According to Dr. Frank Lipman, recurring bad breath can be a sign of a problem with your liver. If you're suffering from this problem often and a trip to the dentist doesn't resolve it, you may need to check your liver. A toxic liver needs detoxification. If you've experienced any of the aforementioned symptoms or are feeling tired often, you may be suffering from liver toxicity. This is not a simple problem and needs to be resolved quickly. Luckily, you can do it with a simple cleansing of the body by eating natural ingredients which will reduce the strain on the organ. Sometimes, these symptoms might be a sign of other diseases and conditions, which is why it's best to visit a doctor once you notice them. A doctor should be able to tell you if something is amiss or liver toxicity is indeed